Thank you. Thank you, Dr. Quinlan.
Um,
I'll share a link in the chat. As I mentioned earlier on, this is just to get some feedback from you, everyone, concerning our webinar series, and also if you have any ideas. So, if you have any questions, since there's just 25 of us, you could just put up your hand if you want to speak up, so that you can speak. Or you could type your questions in the chat and then we would relay that. I do have a direct message that was sent to us. It says, how can we tailor effective food safety messages for older adults who are accustomed to traditional food safety practices, and what strategies can help shift their perspectives to newer, updated guidelines?
Yeah, so what we found is educating them. If you give them the reason, you don't just tell them what to do, but you give the reason why to do that, why to, what the risks are about that behavior. And we found that generally, not only in this research, but some research I did about raw poultry handling, if you give them the why behind the change that you're asking them to make, they're more likely to make that change or be willing to think about making that change. So really, yeah, that the traditional is the hardest to get past, and we see it a lot. But so it's a great question. But generally, in my experience in the research we've been doing, people respond when you give them the science behind it.
Thank you. Any other questions? You can type it or you can just put up your hand and then you can go
And
ahead.
and I'm and again, any suggestions, any thoughts from your experience on what you think the targeted message should address? I'm willing to have that discussion and would and appreciate your feedback.
I had a question, Dr. Quinlan. You mentioned initially that 55 years and above, you would explain why
I'm sorry,
you did
and I
55
didn't,
instead of
I realized I
65.
didn't. Yeah, so the reason we chose that was if you actually look at the epidemiology of it from FoodNet, the reality is that increase in severity and illness, it starts as young as the late 40s. So it really, it's not like you turn 65 and suddenly you're susceptible. The reality is your increased susceptibility starts in your 50s probably. And so that's why we chose to include 55. The other reason we chose to include 55 is when you do that, you get a unique group. We didn't get as many as we'd hoped, but you get caregivers. You get people who are not only susceptible themselves, but people in their 50s and 60s are often caregivers for people in their 70s and 80s. And so we did, we had some caregiver participants, which we wanted. Again, they would be susceptible themselves, but they'd also be caring for someone. But yeah, that susceptibility starts earlier than just when you turn 60 or 65, which many is the point that many studies use. Yeah.
Okay, great. We do have some comments. Someone mentioned that they agree with the creation of simpler posters, thinking of the older adults. I agree. We work with larger fonts and pick a simple message with each poster. And there's a question. Thank you for the presentation. How should we reach to them in this digital age?
How should we what? I'm sorry.
How should we reach out to them in this digital age, to this older group?
Okay. And yeah, um, they do use digital media, so it is okay. They do use digital media. I'm assuming that's what the question means. I but I will say, and this again, not necessarily from this research, but from my experience and some other research, this generation is more likely to be on Facebook than say TikTok or Instagram. Not that they aren't, there's some that are on all of those. But this generation tends to be a little bit more on Facebook than some of those newer apps. So that might be something to keep in mind. But I will say, that you see also so that they trusted brochures. So they still use brochures, which I think is interesting. So don't give up those brochures but again, maybe make them simpler and more targeted. But yeah, it's possible to reach them through social media. They do use it. Yeah. Yeah. And they certainly use, the Google, know how to use, people in their 50s, 60s, 70s, they know how to use computers in the World Wide Web. So I think that's easily, yeah.
Okay. We also have someone suggest I would consider literacy rate and internet availability in conducting future focus groups.
Yes, yeah, that's a good point. Yeah. Yeah, but that was, as you saw, a criteria for us. And in fact, going forward, that is one of our goals, is that when we run, when we, I can't say I've addressed the literacy rates, so that's interesting. But in terms of the internet access, we do hope, where I am now is in a much more rural setting in Prairie View, Texas. And so we do hope to do some in-person, paper, not paper-based, actually, like tablet-based, but where we go to them and administer, so they're not reliant on using the internet, so that we do get a group of respondents that don't use the internet. I would agree, that's important.
Great. Thank you. Do you address the young population that might be susceptible like the older generation?
Um, so I'm assuming that goes to the concept of the vulnerable population. So like USDA has vulnerable populations, and they put older adults in there with those who, yeah, have other conditions. We haven't, in our research, we haven't reached out to that group, but I would, whatever targeted message we ultimately develop, I would assume it would be true for that group as well. So the recommendations, because they are similar for older adults and immunosuppressed, or those with other conditions that make them vulnerable. Any message we would develop should be appropriate for use with those individuals as well. But it's not where we would be targeting at this point. Yeah.
Okay, thank you. Any other comments or suggestions or questions from the audience? We have a few minutes to go. So you can ask Dr. Quinlan anything that comes to mind.
Or with this small group, just happy to have a conversation. It's it's a nice sized group. Yeah.
Yeah, we're a very small group today, so yeah, that you could just speak up if you want to.
Yeah, so Dr. Quinlan, so you mentioned the like working like the health professionals, and it seems like health professionals would be a great venue for food safety messages. But in the past, I would say 5 years, I haven't seen many efforts. I mean, we would love to collaborate with the health professionals, but the pandemic definitely, I think, um, dilute the information or
Mm.
stopped some of the ongoing training we tried, and everything, it seems like, fall apart when it comes to it. I think before the pandemic, I know there are several groups were trying to engage dietitians or nurse, or even my group, we did some work with doctors or dietitians in training. But after pandemic, I think we are not really working on it. So have you had any success working with this specific group? Or are there any plans your team or the teams you collaborating with has some programs for those health professionals?
So to me, the most logical health professionals to get this message across would be the dietitians. And there are efforts. I know the Partnership for Food Safety Education is working to include more dietitians in their backfighter group. And I do hear from dietitians that they need this information. Now that's, the dietitians I'm aware of, but that they do need this information. So I've never worked with nurses or doctors. Quite frankly, I think it's a lot to ask nurses. We've talked to them about nutrition issues, and so for nurses to be the when the source of all information around food, I think is challenging. But because dietitians are more commonly working directly with individuals, so there's more consulting, that they would have these messages. So I do think there's a willingness and an openness of dietitians to get this information. But no, I think we need to work harder with the Academy of Nutrition and Dietetics to get new food safety themes into their materials, their meetings, to get yeah. And I do know that the Partnership for Food Safety Education is trying to do that at this point. Yeah.
Thank you.
Thank you. So I have a question to Dr. Quinlan. So with all this information, I know you said you are trying to create like information for these people. Are you also considering how to even draft these messages? Are you asking them questions on, oh, if we make it this way, the font size, what do you think? The font style, because you showed us in the first slide that it had too much information. Are you asking them questions like that as you speak to them or do all these things?
So ultimately, yeah, I mean, that was as we develop the materials, and that's the next phase, is to get the funding to develop those materials. But the idea behind that would be that, yes, we would be using, as we decide on a targeted message, we would be using the stakeholders' feedback as we developed it. So we might say, here's the message, but then we would be going to the stakeholders, that being the backfighters and the extension agents and potential and dietitians, and saying, how would you see this working best, and consumers themselves. So yeah, in my experience, that's how we developed the latest Don't Wash Your Chicken education campaign, was with a lot of feedback using an iterative process to develop the materials. So yeah, and it seems, and again, what we ended up with was materials that described the why, because that's what we were finding. They wanted to know the why, which goes back to one of the earlier questions. Yeah.
Okay, thank you. Any other questions or comments? We just have 3 minutes to go before we